Today is our committee's second hearing on the skyrocketing prices of prescription drugs. At our first hearing in January, the committee's very first witness, Ms. Antoinette Worsham, she was a compelling witness. Her 22-year-old daughter died because she could not afford the insulin she needed to control her diabetes. By the way, the insulin costs $333 a month. Let that sink in. For $333 a month. 22-year-old college graduate died. Ms. Worsham's testimony was gut-wrenching, but unfortunately, she is not alone. We've heard other stories just like hers from our constituents, our friends, and our loved ones. Today, we are examining the price of a drug called Truvada. Truvada is a phenomenal drug that prevents the transmission of HIV through a treatment called pre-exposure prophylaxis, or PrEP for short. At the outset, I want to recognize the efforts of our distinguished colleague, Congresswoman Ocasio-Cortez. She has been leading the charge on this issue, and it is because of her efforts that we are holding this hearing today. I want to thank her for her phenomenal leadership. Think about this. We now have a drug that has the potential to end the HIV epidemic. This would have been unfathomable at the height of the HIV/AIDS crisis. This is an issue that I've been dealing with and working with communities on for more than 20-some years. I've seen many people die. I've seen people who used to be on the choir in my church die. I've seen neighbors die. And we have made these phenomenal strides. But this treatment was developed as a result of investments made by the American taxpayers through the National Institutes of Health and the Centers for Disease Control and Prevention. The problem is that Gilead, the company that now sells this drug, charges astronomical prices. When Truvada was first approved in 2004, Gilead charged about $800 per month, again, for this life-saving drug. Since then, Gilead raised the price of this drug over and over and over and over and over again. It now charges about $2,000 for just 1 month, or about $70 per pill. Think about that. Life-saving drug. In the same period, Gilead has made massive windfalls on this treatment, more than $36 billion in revenues. Let me say that one more time. They made more than $36 billion on this drug alone. How can Gilead do this? How can our system allow a company to take a drug treatment that was developed with taxpayer funds and abuse its monopoly to charge such astronomical prices? This life-saving treatment would not exist but for the research funded by the CDC and NIH. So how can our system let a company charge prices that are so outrageous, making $36 billion, while there are literally hundreds of thousands of people who need this drug? We're better than that. These are some of the hard questions we will ask Gilead CEO Daniel O'Day, who is here today. And I'm praying that you do not come and give us the normal rope-a-dope stuff that we usually hear about the various little programs you got, the coupons you got. We want the prices to come down. We want truth. We want to know why it is that the prices are going up astronomically. We want to know what this R&D is all about. We want to know if it's all about vacation, giving doctors vacations and encouraging them to prescribe certain things or not. We need to know all about that. We appreciate that Mr. O'Day accepted our invitation to participate, and we anxiously look forward to his testimony. The reason this is so critical is because the CDC estimates that there are 1.1 million people at high risk of contracting HIV who could benefit from this drug, but that only a fraction are getting it. Use is shockingly low among groups that are particularly high risk, including communities of color that have been disproportionately impacted by this epidemic. This treatment is available in other countries for much, much less. In Australia, patients pay less than $7 a pill. Hello. Here we're paying well over 70. In other countries, patients pay less, even less. This is because Gilead charges less for its treatment overseas than it does in the United States. It's also because Gilead has generic competitors there, but not here. Finally, let me note that this is a bipartisan issue. HIV has no boundaries. It affects blacks and whites, rural, urban. It is a tough disease. President Trump recently announced an initiative to end the HIV epidemic within 10 years. This is a laudable goal. However, it relies on this particular drug treatment getting to everyone who needs it. Gilead recently agreed to donate millions of bottles of this drug, but far short of what we need to save lives. Without addressing the fundamental problem of pricing, I'm afraid that we simply may not get there. So we want to work with the President in addressing HIV, but we need to start right here, and we need to start right now. So without further ado, I want to recognize the distinguished ranking member, Mr. Jordan, for his comments.